But she's also having like big time mood issues. Like she feels stressed. She has like obvious estrogen dominance. Like she has like tender breasts. She trains a lot, or else she'd probably have like belly fat, but she's pretty lean. So looking at her test, her estrogen is through the roof, which we suspected. Her progesterone is low, too low to balance out her estrogen. And her testosterone's actually really high. And she has high like androgen testosterone. So she's having other symptoms like facial hair, super oily skin. She has super thick hair, but most people would start to have like hair loss in that scenario. She has sufficient DHEA, but she's just making a lot of hormones. And her cortisol is high, but she has an inverted car curve, which means instead of waking up and having your cortisol raise 30 minutes after waking up, she starts high and her cortisol drops. So it's just a sign of dysfunction, HPA axis dysfunction. So that can happen whether her cortisol is high or low, but her cortisol is really high. And she has okay cortisol clearance, but I think we could do better.
What was the original reason she came in?
She felt super off. Her hormones felt really unbalanced, which they are. All of her hormones are very high. She has...
Like, what were the symptoms, though? How did she know that?
She has excessive, like, estrogen symptoms, like
tender breasts and...
Yeah, like tender breasts, like emotional things. Like, she feels stressed. She has, like, she has like circular thinking. Like she gets like obsessed with one thing.
And so she has like a couple hormonal values that feel out of whack. And so you recommended a Dutch Plus test?
Mm-hmm. Yeah. So we have a Dutch Plus test. We ran a Dutch Plus test on her because this is going to show the why behind a high and low on a blood test. It's actually a little bit low progesterone, which we saw up above. Her estrogens are very high, and she's picking a less favorable detoxification pathway. And we have detoxification pathways that go, that basically detox our hormones. It goes to the liver, it breaks down in the liver. But we can pick like less favorable pathways, which, you know, that can be the starting of like certain estrogen related cancers. It can be more inflammatory. Men and women can have both of those. It can come from having too much plastics in our environment, excess alcohol, too much processed food. It can be high stress. It can be really synthetic smells is one thing that I see quite often. Pollution is another one. Using a lot of like scented household detergents and cleaners. She has a less favorable pathway, so we're gonna shift that. That can be another like very inflammatory pathway for her, like blended with the estrogen dominance. Like we need to flush both of those and move that pathway. So basically what we're gonna do for her is we're going to give her some supplements, some short-term supplements for 3 months that help clear out of the liver. But the 5A DHT is also causing her symptoms. So she's basically estrogen dominance and very high testosterone.
What does testing show you that you would do counterintuitive to like normal recommendations?
Do you know what a lot of people would look at this and see as far as like the healthcare system is they would probably put this person on birth control just to blunt all hormones, which is super scary. Like it doesn't need, she doesn't need birth control, you know, she just has high hormones, and it could be because she needs some liver, like some detoxification pathway support. This happens quite a bit with stress. Like she's just making a lot of hormones. Oftentimes I see athletes who are used to this massive amount of volume. Their body has become like very efficient with the volume, and then they taper down volume and their system is like, wait a minute, where are we gonna dump all of these hormones and all this excess cortisol? Like I see that happen quite a bit with like former military guys that come home and they're like, I'm going crazy because I need to dump cortisol.
Oh yeah,
so
plus the environmental toxins and whatnot.
So this person just moved. She just barely set up a gym. She's not in her routine. Like she's an athlete. She's like trained up to like have this certain level of activity, and now she doesn't have it, plus some added stress. So I see more often than not, doctors would just put someone like this on birth control. I mean, you couldn't put her on testosterone. She's already making a lot of testosterone. You couldn't put her on estrogen because she's already on a lot of estrogen. You could balance her out with a little bit of progesterone, but progesterone can also raise other hormones. So this is a cool panel because it shows all of the hormones, parent hormones and pathways. So above pregnenolone would be dietary cholesterol, and then pregnenolone, we start to make pregnenolone, and then we decide what we're going to make. Are we going to make progesterone? Are we going to make estrogen? Are we going to make testosterone? So pregnenolone either makes progesterone or DHEA, and then testosterone and estrogen. And this person's just so high with androgenic testosterone, but she's also not picking the appropriate pathway. She needs to be a little bit more balanced here. So if this was a male and a male was way over here picking this like 5B pathway, this male might have like estrogen symptoms. So they might like not be as emotionally resilient. Like they might get cut off in traffic and be like, I need to like pull over and basically cry. I'm not joking. So it's a very like, it's a very interesting pathway. So the other way is like a very androgenic pathway. It's like, you know, cystic acne 19-year-old boys that are like so oily and so, you know, pimply. You don't want that. And there's some hair loss that can happen with that too. So you really want to be balanced, you know, and we can balance these out. This person is really high in this 5 DHT, which we can give her some supplemento. We can give her some zinc. For a male, it could be like copper and zinc. So it would balance out with like micronutrients. We come down here and we see the pathways that all of the estrogen and hormones are taking, and we can actually see what it looks like in the liver. So all hormones go through the liver. The liver breaks down the hormone, sends it to the GI. The GI gets rid of it. We flush it, theoretically, and then we make new. But a lot of times our hormones get stuck in the liver, and this can happen because a lot of things are going through the liver. Sometimes I see people that are just taking so many supplements, or they're not flushing like their testosterone injections well enough, or they're taking tons of antibiotics or Ambien or allergy medication. I see it quite a bit, and their liver just gets full of hormones, and we just need to like flush it. So that we need to give the liver a little bit of support. So in this case where this person is picking this 2-OHE1, I'll most likely give this person some DIM and shift the pathway, give her some liver and some supplemento just to like dump some of the androgenic testosterone and hopefully balance her out. A lot of times we can do we can give some liver support and it balances hormones out pretty well, which is cool. So I like the lowest intervention as possible. And usually I'll start at the liver, because if we give a bunch of supplements and the liver needs to be detoxed, then we're just gonna make the whole system downregulate even more. We also need to fix her cortisol. I know this person is sleeping a lot. So she's sleeping like 8 hours a night. So she should be getting pretty good sleep. She might not. I think her melatonin was pretty low. So we might give her a little bit of GABA just to put her into like deeper states of sleep. So her time in bed is actually like deep sleep. She's getting enough all ranges of sleep.
How long will it take to like resolve these major issues? Or like, since you can't, obviously you're talking about different phasing, it sounds like can you do everything all at once?
No, we'll have to do different phases. So my first phase will be support the liver and balance her out with some nutrition. So I want to make sure that her cortisol is high, her blood sugar is balanced, she's sleeping really deep, and then we'll probably come in and see how she feels. So we'll do like a symptom checklist to see if her hormones have balanced out. She's pretty self-aware, so some people we would just have to test again. I think we can get away with like a questionnaire with her and just see how she's feeling, because hormones have like very specific feelings to them. And so we can see how she's feeling and just move her in the right direction. And then she might need some gut health, but definitely the deep sleep. We need to get her clearing cortisol. That's another thing that we can do with liver support. So a lot of her issues right now will be resetting her detoxification pathways in her liver. that's where I'm going to start. And then she has some micronutrient deficiencies. So her cortisol is high. Rhodiola is really good for high cortisol. I think that will like bring her down and get her to clear a little bit better. A lot of people would say ashwagandha, but sometimes it floors people. Sometimes it can make cortisol go higher. Adaptogens kind of like go wherever they kind of go where they're needed, but sometimes they can mimic a hormone, or they can mimic cortisol and actually elevate the issue. I've seen that happen quite a bit. So she's within range on all of her markers, but she is a little bit low on B6. So I would probably give her a little bit of B6, especially since she's stressed right now, like in her personal life. So that would also pair with magnesium. We'll make sure that she has some good magnesium glycinate before bed just to help her sleep. Her oxidative stress is really high. Sometimes this marker comes up high with athletes, but it's definitely on the radar. Melatonin is low, like I said, so we'll get her sleeping really good. No epinephrine or adrenaline is low. It's below range. Her dopamine is kind of like right on the border. So when we give her GABA, we'll actually give her a little bit of tyrosine, which is the precursor to dopamine. So is B6. Filling in some of these micronutrients. So think about it like this. If you're not sleeping, then hormones will be dysregulated anyway. So will cortisol. So she might be wearing herself out because her cortisol is so high. If we were to test her in 2 months, it might be really low because she's kind of been at this high cortisol state for a long time. She's worn her system out. We'll try to bring her cortisol down and like practice some good calming lifestyle protocols like breathwork, box breathing, NSDR, things like that. So for her plan, we'll give her some light nutrition support. She's actually still running quite a bit, so we can't balance her blood sugar out to the point where she's not recovering, but we'll probably open up an hour to 90 minutes, give her some recovery style food so she can recover with carbs. And then after the 90-minute mark, I actually really like doing this with athletes. We'll throw in something protein and fat based so that it stops the cortisol elevation. She's done recovering, and then we kind of close that blood sugar spike. You can do it with like red meat and avocado. You could do it with eggs and avocado. So something like that. And it kind of like blunts that cortisol from just going rampant into the afternoon. I mean, she should start feeling better within like 3 weeks. Like here's the thing, like if you're on the right track, you start feeling better pretty quickly. Like, you know, week 1, you'll have noticeable better sleep, you know? And so just with that, you start to resolve some issues. The liver starts to clear out a little bit, and you start to like flush hormones. You start to feel a little bit better. So it's like every week that you're on this protocol, you start feeling better and better and better. But to resolve and actually move metrics on a test, like 2 to 3 months. With her, it's easier to bring cortisol down than it is to bring cortisol up. Mm-hmm. Yeah, I would say like 3 months to fully get her system recovered, as long as she like does the protocol.